The case study we will be talking about is hypochondriasis by Eriza, Sarina, and Lemuel. What is hypochondriasis? It's an illness anxiety disorder, sometimes called hypochondriasis or health anxiety. Is worrying excessively that you are or may become seriously ill. You may have no physical symptoms. Introduction. The summary of our case study. Wally is a 42-year-old who came to get x-rays and other tests, and they have shown that nothing is wrong. He has had stomach pain, nausea, vomiting, and diarrhea for years. And with all the workups he's had, it has shown that he is healthy. Unmarried accountant, he is not very social. His father and mother were always anxious about everything when he was growing up. His parents struggled financially and both died in a car crash. He has worried about getting cancers for years. He worries about clinicians making a mistake about his lab work.
Cognitive theory and hypochondriasis. First, I'd like to start with connecting it to the topic that we have learned in class, which is the cognitive theory. I think we can relate this theory as to what behavior was displayed by Wally. Cognitive theory focuses on idea that how and what people think leads to the arousal of emotions, and that certain thoughts and beliefs lead to disturbed emotions and behaviors. And the hypochondriasis is a health anxiety which is worrying excessively that a person are or may become seriously ill. So how is the disorder is presented? According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, um, the disorder is presented by general appearance, behavior, and speech. By cooperative with the examiner, yet ill at ease and not easily reassured. For the psychomotor status, on Wally's case, he hasn't been able to sleep because of his abdominal pain. For the mood and affect, he's always anxious and worried. For the thought content, he's anxious themes concerning what in the body is wrong, how it is wrong, and how it is experienced. Wally also said that he doesn't have suicidal ideation. For the cognitive function, you see, it's a rare difficulties with concentration. Just like what on his case study, he hasn't been able to concentrate because of his fear of having serious illness. For the insight, lacking full understanding and underlying psychological concerns and how they underpin development and maintenance of bodily complaints. As for his judgment, he's still capable of social greetings and other behaviors. For the signs of hypochondriasis, according to the research, signs of hypochondriasis are being preoccupied with having or getting a serious disease or health condition. Worrying that minor symptoms or body sensation mean you have a serious illness, being easily alarmed about your health status, worrying excessively about a specific medical condition or your risk of developing a medical condition because it runs in your family, having so much distress about possible illnesses that it's hard for you to function, repeatedly checking your body for signs of illness or disease, frequently making medical appointments for reassurance, or avoiding medical care for fear of being diagnosed with a serious illness. Also, constantly talking about health and possible illnesses, and lastly, frequently searching the internet of causes of symptoms of possible illnesses.
The symptoms that was shows in our case study are that Wally often begins tasks only to stop what he's doing to Google his symptoms in WebMD, and he had at least four works up by excellent clinicians and gastroscope, finding little or no reassurance from his doctor. visits or negative test result. He is having so much distress about possible illnesses that it's hard for him to function, and he constantly talk about his health and possible illnesses. What could be the cause of his illness? It could be the severe bullying that he has experienced as a kid and never fit in because he is an only child. He has also observed his parents when they are struggling with finances, observed his mother having a panic attack in front of him, and both of his parents died in a car crash, and now he has no one to rely on.
Now I will be talking about the risk factors that is seen in the case study. Hypochondriasis or illness anxiety disorders usually occurs during early to middle adulthood and can get worse as a person ages. The risk factors for hypochondriasis may include trauma. In the case study, Wally at a young age witnessed the arguments of his parents and the panic attacks of his mom. His parents also died in a head on car crash, and those left a traumatic experience for him. Another risk factor is the excessive health related internet use. Wally often begins tasks only to stop what he is doing to Google his symptoms in WebMD. Finally, personality trait. Wally, as being a warrior, every time he experiences symptoms, he will worry that it may lead to something serious. So, what are the treatments that are available in relation to this case study? Aside from regular visits to a healthcare provider, people diagnosed with hypochondriasis may also benefit from self help treatments and psychotherapies. These include learning stress management and relaxation techniques, also avoiding online searches for the meaning behind the symptoms, as well as working to recognize that the physical signs you experience are not a symbol of something ominous, but instead, these are actually normal body sensations. Types of therapy that can be used as a treatment is cognitive behavioral therapy or CBT. This type of therapy helps a person recognize and understand the false belief that set off their anxiety. Drug therapies or intakes of antidepressants, including selective serotonin reuptake inhibitors or SSRIs, like fluoxetine and paroxetine, may improve the anxiety and physical symptoms of hypochondriasis. Finally, nutrition is also one of the treatments that it includes eliminating suspected food allergens, eating antioxidant foods, avoiding refined foods, avoiding stimulants such as coffee, drinking adequate amount of water, and finally exercising regularly. So, how is this related to psychology? One of the treatments that can potentially help Willie or Wally in attending therapy sessions. Different types of therapies are discussed in one of the lessons in psychology. Included in the therapies is cognitive therapy, which relates to the case of Wally. This is a short term form of psychotherapy based on the concept that the way we think about things affect how we feel emotionally. Cognitive therapy focuses on present thinking, behavior, and communication rather than on past experiences, and it is oriented toward problem solving. This kind of therapy will help Wally in a way that he will learn to focus more on bettering himself rather than worrying about the illness that he thinks he has.
How stress plays a part in hypochondriasis. The quote I found in one of our topic is a major source of stress in life is worrying too much about minor things. That is by Mark Amend. Hypochondriasis is highly connected to stress. This case study foundation is stress. The more he worries, the more the stress adapt to the severity of the stress. One of the reasons his condition worsened was because his stress adapted too much. He worries about having sickness so much that even a negative result from the doctors won't make him believe it.
In conclusion, overall, it may be said that hypochondriasis is a serious anxiety disorder that affects the physical and mental well being of a person. In this case, Wally is the person who experiences this. Various topics were discussed in this case study, such as how hypochondriasis is presented, the signs and symptoms of the case study, what are the causes, the risk factors, and finally, the treatment of the said anxiety disorder. This case study also made a connection to the lessons tackled in psychology. These lessons are the cognitive theory, stress, and therapies. Making a connection with these lessons helped in the further understanding of the case study. This study gave the opportunity to have a wider view of the reality of having an illness, anxiety disorder.